Changes are on the horizon for medical facilities nationwide following cuts to Medicare and Medicaid coverage contained in the One Big Beautiful Bill.
KTIV's Connor Trett traveled to a Northwest Iowa hospital to find out what changes are on the way and what impact those changes could have on rural hospitals.
For us, Medicare and Medicaid, as in most rural areas, is 50% or better of the revenues that you generate to do your operation in.
Hospitals across the U.S. are preparing for changes after President Trump's Big Beautiful Bill passed, which included a large cut to Medicare and Medicaid coverages. I spoke with Gary Jordan, the CEO of Cherokee Regional Medical Center in Cherokee, Iowa, to see how they're preparing for those upcoming changes.
Our viewpoint is to start planning for those cuts. It's like anything else. When funds go away, it makes changes in your operation.
Jordan believes that Cherokee Regional Medical Center will be able to roll with the punches for the upcoming cutbacks. But for some rural hospitals owned by their city or county, oftentimes with a surrounding population that's smaller and older, he says could have a harder time staying afloat.
The fact of it is, those cities and counties can't afford to put any more tax dollars in there, so that impacts, what they can do financially. So I think it's really a challenge for many communities to kind of keep their hospitals, especially smaller population.
The changes to Medicare and Medicaid coverage will come in phases. According to the bill passed by the U.S. House, in 2026, changes will be made to the frequency beneficiaries need to renew their eligibility. In 2027, coverage will be restricted to provide federal payment for services only to U.S. citizens and other lawful permanent residents. In 2028, the maximum rate that states and by proxy hospitals can receive for Medicaid coverage will begin to gradually decrease from 2028 to 2032. Jordan says that the gradual drop in funding gives hospital staff time to plan and prepare.
Well, I think the biggest thing is that we control our costs. We don't want to be in a situation where we're having to do some sort of major cuts, cutting services, cutting staff. And we want to make sure that we never be in a situation where we're having to do something in a knee-jerk reaction.
That's Connor Trett reporting from Cherokee. Jordan added that while the gradual cuts to Medicaid coverage help to ease healthcare providers into those new rates, providers can't feasibly continue to have that funding cut and expect to be successful.